To our top international story, and it's a very worrying one. COVID-19 infections continue to climb in India. The country has been struggling to get enough oxygen for patients, and hospital beds are running short. Yesterday, a staggering 400,000 new cases were recorded, with more than 3,000 deaths. International aid has been arriving. Let's get the latest update from our correspondent in Mumbai, Rebecca Bundhun. So, Rebecca, let's start with the current situation. What's the latest?
Yes, indeed. Those numbers are worrying. They continue to be worrying, with more than 400,000 cases reported in one day on Saturday. That was again a global record daily surge. Now we've seen a slight dip in the latest figures that have come out today, but they're still really worrying numbers. More than 368,000 cases in the past 24 hours, according to the latest numbers. And then again over the weekend, that record number of daily deaths as well. And really, also, what's the big concern is the situation on the ground, which still continues to be really, very, very difficult, with hospitals continuing to report these shortages of oxygen. This has been going on for several days now. Again, there was a hospital in Karnataka that ran out of oxygen, and that led to the deaths of more than 20 people. Hospitals in Delhi as well still reporting that they're running low on oxygen supplies, despite all the efforts that are ongoing to try to get oxygen to hospitals, including that international aid that's coming in, efforts by the government as well. There's the Oxygen Express train that is meant to be bringing in supplies to states that need it, but still on the ground proving very difficult. Shortages of hospital beds are ongoing, those shortages of medicine, including remdesivir. There is some ray of hope, potentially, with some experts predicting that we could actually start to see the number of coronavirus cases on a daily basis start to peak in the next few years, in the next few days, that we could start to see these peaks coming through, which is promising. But still, the situation here is very, very difficult in India, and a lot of patients are struggling, and we're still hearing these reports of people losing their lives because of the shortages that are severe in India in terms of the healthcare infrastructure.
So let's talk about how we got here. Were there enough lockdown measures in place to actually prevent this? Because we saw visuals of thousands of people gathering at the Ganges River just recently and all over the country.
Yes, well, this has been the main criticism, really, that obviously last year India had that very, very strict nationwide lockdown, which came into effect just hours after it was announced. It was one of the strictest lockdowns in the world. Then after that, through 2020, as the year progressed, the government steadily allowed things to open up. And then by earlier this year, India was seeing far fewer cases. Even the government had said that it had basically beaten the virus, essentially. There were fewer cases, and people were going out and about, going to these gatherings. Even there were these religious festivals, including the Kumbh Mela, where there were hundreds of thousands of people gathering on the banks of the Ganges, very few people wearing masks. There were also the election rallies that have gone on over the past few weeks. That's been a really big criticism of the government, because even India's Prime Minister Narendra Modi addressed some of these rallies that took place in these key state elections, including West Bengal, and it's come through with the results that he was actually defeated in that election by Mamata Banerjee, by a regional party. So despite all those efforts and people saying that his focus was on those state elections rather than the coronavirus pandemic, he missed out on that election. And people really have been very, very critical. And there are even calls now by many experts to actually introduce another full nationwide lockdown. And that's something the government at a central level said it's against doing because of the economic impact. Although we have seen lockdowns coming into effect at a state level, including in Mumbai, which is part of the state of Maharashtra. There's currently a lockdown in effect here. Also, Delhi's been in lockdown as well. So there have been measures taken by the state government, but the central government has avoided introducing lockdown restrictions at a nationwide level because of the economic impact, it says.
Yeah, so Reuters reporting in an exclusive that a forum of scientific advisors warned the government about a new and more contagious variant of the coronavirus in India, but they were ignored.
Yes, so this has been something that doctors have been warning about as well for a long time, because although the government has been saying, well, a major factor behind this huge second wave of infections is people not following COVID-19 precautions, not wearing masks, not observing social distancing practices. A lot of doctors have been, for several weeks or even months, saying that the Indian variant is more infectious, that it's causing a greater impact on patients' lungs, that because of the Indian variant that we're seeing here in the country, and even other new variants as well, they're saying that that's looking like it's more infectious. They've noticed that once one person in the family gets it, it very, very rapidly spreads to the entire family, they say. They've been warning about this for some time. And they've also said that it seems to be putting more people in hospital, that because of its impact on the lungs, a lot of people are requiring ventilator support. And they're saying that even younger patients, people in their 30s, they're needing ventilator support because of the impact of this virus. So that's something they have been talking about for some time. Yeah. And that's worrying as well. If this was raised to the government and it was also ignored, again, it's another point that people are criticising the government on. And a lot of people are saying that the government has been slow to react to the situation. They are blaming the government now. So that's something that's going to go, but that's something that's going to be ongoing as people continue to struggle with this crisis.
Yeah, and lastly and very quickly, lots of criticism on Prime Minister Narendra Modi for a large part of the world's vaccines actually being produced in India, yet locals are not getting vaccinated quickly enough. Has he moved to address that concern at all?
So the Indian government has said that the vaccination drive is really its main way out of the pandemic, and it's encouraging everybody to actually take the vaccine. But I mean, there have been some efforts by the government to actually boost vaccine production. It did give these grants last month to the manufacturers, the Serum Institute of India, which is producing the AstraZeneca vaccine in India locally, and also Bharat Biotech, which is producing a homegrown jab. So there were those kind of efforts. It's also slowed exports, because this was one of the major problems as well, that India actually exported a lot of vaccines earlier this year, tens of millions of doses. But now it's definitely slowed down or even halted the vaccine exports. So those efforts are ongoing. But still, the fact is that it's only about 2% of the population so far that have been fully vaccinated, even though the vaccination drive started in January. And this weekend, actually on Saturday, the 1st of May, India officially opened up its vaccination drive to everybody over the age of 18. But so many of the states and so many of the vaccination centres just didn't have any stock. So actually, a lot of people have been unable to get the vaccination, even though it's open to them. They've reported that the app has been crashing, that they can't register on the app. So even Mumbai today, there are a lot of centres that were that had completely run out of vaccines. A lot of people have been telling me that they can't get it, even though they're due for their second dose, that they had their other vaccine a couple of months ago, the first dose, and they just can't get it. So this is an ongoing problem as well, that India does need far more doses of the vaccine, even though India is the world's largest producer of vaccines. And it looks like India is even now turning to looking at importing vaccines as well, as it tries to meet these needs.